Hello, my name is Anna Gabriel, and I work as a clinician scientist at the Department of Dermatology at the General Hospital of Vienna. I'm very excited to share today with you our very promising results from our clinical trial, where we explored mTOR inhibition as a new treatment for cutaneous sarcoidosis. So let's begin with a brief overview. What is mTOR? mTOR is a protein kinase which is found in every cell of the human body. When mTOR is activated, it promotes cell growth, cell proliferation, and when mTOR is hyperactivated in certain pathological conditions, it can contribute to inflammation. There are several scientific analyses which have demonstrated that mTOR is overexpressed in sarcoidosis granulomas and the immune cells inside the granuloma. This hyperactivation seems to play a key role in the disease process. So based on these findings, we designed a clinical trial at the Department of Dermatology from the General Hospital in Vienna to investigate whether mTOR inhibition could be a safe and effective treatment for sarcoidosis. For this, we used Sirolimus, also known as Rapamune, an already established immunosuppressive medication that has been used for years in kidney transplant patients. So in our trial, we enrolled patients with cutaneous sarcoidosis. The study was conducted in two phases. So first, patients were treated with a topical formulation of Sirolimus in a placebo-controlled manner over 2 months. This was then followed by systemic administration of Sirolimus for 4 months in the same patients without a placebo control. After completing the systemic treatment, patients remained in the study for an additional 2-month observational period. So now let's have a look at our results. The topical treatment did not show a significant improvement, so I will not go into further detail on that. However, the systemic therapy showed remarkable effects. We saw an overall reduction of skin inflammation measured with the Cutaneous Sarcoidosis Activity and Morphology Index, and this significant reduction remained stable up to 2 months after treatment was finished. If we now look into more detail, we can see here that especially 7 out of 10 patients experienced a significant improvement in their skin lesions. So to illustrate these results, I have depicted some clinical images from 2 patients. And we can clearly see that the skin lesion, the face lesion, it's here from this patient significantly improved after 4 months and remained stable up to 2 months after end of the treatment. And the same was seen in this patient here, where the lesions on the arm disappeared after 4 months of treatment. Here is another example from one of our patients with isolated sarcoidosis inside of a tattoo. And we can see that this patient also responded very well to the systemic treatment. Importantly, we did not observe any serious adverse events, and all of our patients tolerated the therapy well. So given these very promising outcomes, we have now established a clinical workflow at our department to offer Sirolimus treatment to patients with cutaneous sarcoidosis outside of the clinical trial. So this is just a brief summary slide. Patients with histologically confirmed cutaneous sarcoidosis who do not respond to systemic glucocorticoids may be eligible for Sirolimus treatment for a minimum of 4 months. The therapy was very well tolerated with manageable side effects, which were limited to the treatment period. And here is a summary of the most common adverse events we observed. So finally, let's have a look at the current evidence on mTOR inhibition in sarcoidosis. So although the data is still limited, there are several case reports showing that systemic mTOR inhibition can be effective in treating different forms of sarcoidosis, especially liver, laryngeal, lung, cardiac, and cutaneous manifestations. A particularly fascinating case is highlighted here from Hindré et al., where they reported about a patient with multisystemic sarcoidosis affecting the skin, lungs, bones, spleen, and liver. And this patient had not responded to conventional treatments, including glucocorticoids, methotrexate, hydroxychloroquine, TNF-alpha inhibitors, and even JAK inhibitors. And remarkably, after 12 months of systemic treatment with sirolimus, the patient experienced a significant symptom relief across all affected organs. So in summary, our findings suggest that mTOR inhibition with sirolimus is a promising and well-tolerated treatment option for patients with especially cutaneous sarcoidosis who are unresponsive to standard therapies. Thank you very much for your attention. This is my contact down here if you have any further questions.